There's a lot of concern about coronavirus variants and what kind of effect they will have on some of the improving numbers in the United States and around the globe. There is new research, though, that shows at least one of the vaccines is effective against one of those variants. Our Anjalee Khemlani tracking all of this for us. So what do we know now about the vaccines and the relationship with the variants?
So what we've got today is the Pfizer-BioNTech vaccine proving effective against the Brazil variant, or sorry, the variant that came out of Brazil, P1. And so that's important because it now lines up all three concerning variants. That's the one that came from the UK, B117, the one from South Africa, B1351, and now P1 as well. All are proving to be, the vaccine is proving to be effective against them. Now, this is all in a lab setting. So it's important to remember that that is a different scenario than in real life. The only real life or clinical trial examples that we have are from Johnson & Johnson and Novavax, and they've tested it against the UK and South African variants, and we've gotten responses there. So bottom line is right now, overall, the vaccines seem to be working against the variants. We know that the B1351 from South Africa is the most concerning because it has certain mutations that can make it less effective, and it has decreased the effectiveness of some of the vaccines, but it's not to the point that is overwhelming just yet. But still, we know that companies are working on boosters and other ideas on how to combat degrading effectiveness.
And Anjalee, just right after we went off the air yesterday, we saw that big announcement from the CDC around their guidance on what vaccinated people can and cannot do. We were just chatting in the break that it kind of seems like it's being publicly announced as the grandparent guidance. Walk us through some of what we learned from the CDC yesterday.
Yeah, I mean, it does have the biggest impact for what people are most concerned about, right, which is visiting grandparents. But let's go through it. So first of all, it only applies to the guidance is basically for fully vaccinated people. And what that means is 2 weeks after your last dose when you're taking the Pfizer or Moderna vaccine, or 2 weeks after the Johnson & Johnson shot. So you need to wait that 2-week period. After that, people who are fully vaccinated can all mingle together, no masks required. But when it comes to, and people who are vaccinated and hanging out with unvaccinated people, if they're low risk for contracting COVID, so say in the younger population or without health risks, then you can hang out with no mask. But if you're hanging out with someone who's elderly, who has high health risks, high risk for contracting COVID, that's when, even if you are vaccinated, you have to continue wearing masks, ensuring proper ventilation, staying distant, washing hands, etc. All proper precautions need to be taken in order to continue hanging out. So that's what came out of the CDC yesterday. There was no update to the travel guidelines, and that's also an additional question, especially when you're thinking about visiting family and friends. No update to travel guidance. The CDC is still recommending no travel, but health experts are saying that's likely to change sometime in the near future as we get more people vaccinated.
Anjalee, I have one more question for you, which is, all along there have been questions about whether if one is vaccinated, one can still be infectious, somehow harbor the virus without being infected with the virus. When are we going to know? I mean, presumably there are studies underway on this. When are we going to have more information on that question?
That is another reason why the CDC continues to recommend wearing masks even after vaccination, is because of that. We don't know the answer to that, and that's where that concern about the high-risk population comes in. Studies are ongoing, and they do not know the answer to that yet. So once we find out, that's when you can expect yet another update. So we know we saw some pretty good data coming out of the Johnson & Johnson study about transmission, but it's all still under review, and the scientists are still looking at it.
Looking forward to getting more information about all of this. Thank you for sharing it with us. Anjalee Khemlani, talking to us, as always, about the latest developments with the coronavirus.